This basic lecture is about how to do linear endoscopic ultrasound examination and how to find landmarks during EUS examination of different abdominal structures and also the mediastinal structures. There are many abdominal structures which can be visualized during endoscopic ultrasound examination, including the systemic veins like IVC and the its tributaries, and also the aorta and its big branches like the celiac axis and superior mesenteric artery with its main branches. And also you can see the portal venous system, including the portal vein with the splenic and superior mesenteric vein. And also we can visualize the gallbladder with the biliary system, including the common bile duct. And also can visualize the pancreas with its main parts, including the pancreatic head, the uncinate process, the pancreatic body, and the pancreatic tail. So there are many intra-abdominal structures which can be visualized during endoscopic ultrasound examination. So there should be a roadmap or landmarks for systematic examination in order not to miss an important structures during EUS examination. Actually, there are many stations during the endoscopic ultrasound examination, including 4 stations and also the mediastinum. Some endosonographists prefer to start from station 4 to just below the cardia, and then go forward to examine station 3 at the duodenal bulb and station 2 at the papilla, and station 1 just below the papilla. And others prefer to do the opposites, just going to the deep second part of the duodenum, just below the papilla at station 1, and then gradually withdraw the echo endoscope to examine station 2 at the papilla, station 3 at the duodenal bulb, and station 4 at the cardia, and lastly the mediastinum. So both methods are correct, and I think the best method is the method you are used to do and the method you are perfecting. Now we are starting examination of the station 1 just below the papilla. Here the echo endoscope is just below the papilla, and here we do upward deflection by the big wheel. Then we can see a longitudinal tubular structure. This is the abdominal aorta appearing in longitudinal section. And the part of the pancreas related to this abdominal aorta is the uncinate process of the pancreas, seen from the deep second part of the duodenum just below the papilla. Here scanning from the deep second part of the duodenum with slight upward deflection by the big wheel, we can see a longitudinal structure which is the abdominal aorta. And here, this part of the pancreas at this side is the uncinate process of the pancreas. This is the uncinate process of the pancreas. We can see it only from station 4 from the stomach, just below the cardia. So during our examination, we can see the uncinate process of the pancreas in station 1 in the deep second part, and also we can see it again from station 4. When we go to the station 4, we can see the uncinate process also from the stomach. Okay. This is station 2 just at the papilla. We withdraw the echo endoscope slightly to see the papilla in the endoscopic view, and now we are sucking all the air inside the second part of the duodenum to kiss the papilla. The landmark of this station is the stack sign, the meeting of the common bile duct and the pancreatic duct. The common bile duct is the tube or the channel near to the echo endoscope inside the lumen. And the second tube, which is next the common bile duct and away from the echo endoscope, is the pancreatic duct, and of course it is slightly smaller than the common bile duct. The upper limit of the common bile duct is about 7 millimeter, and after cholecystectomy the upper limit may be up to 9 millimeter, while the upper limit of the pancreatic duct diameter is 3 millimeter in the head region here, and 2 millimeter in the body region, and 1 millimeter at the tail region. So the landmark of this station 2 at the papilla is the stack sign, the common bile duct near to the lumen and the echo endoscope, and the pancreatic duct is the far channel from the echo endoscope. And here there is pancreatic tissue of the head region is around the 2 ducts, and this is the region of the papilla. Now the echo endoscope is kissing the papilla and the mid-second part of the duodenum, and here this is the abdominal aorta appearing as a circle in cross section, and here this is the stack sign. This is the region of the papilla, and this is the common bile duct, the channel nearest to the echo endoscope, and this other channel is the pancreatic duct. So this is the abdominal aorta, and this is the common bile duct, and this is the pancreatic duct, and here this is the superior mesenteric vein and the superior mesenteric artery. So this is the IVC, aorta, common bile duct, pancreatic duct forming a stack sign, and this is the superior mesenteric vein and the superior mesenteric artery. And here this is the region of the papilla, and here part of the head of the pancreas, and this is the lumen of the second part of the duodenum, and this is the muscularis propria of the duodenal wall, and here by forward, gentle forward and backward pushing, and gentle clockwise and anti-clockwise rotation, we can trace the common bile duct and the pancreatic duct. Here the common bile duct is 5.5 millimeter, the upper normal is 7 millimeter, and in the pancreatic duct is 2.5 millimeter. The upper limit is 3 millimeter at the region of the pancreatic head. So this is the common bile duct, and this is the pancreatic duct, and here this is the venous confluence, and this is part of the head of the pancreas. Now we are doing a gradual withdrawal of the echo endoscope and scanning through the upper second part of the duodenum. So we can see here again, this is IVC, and this is the aorta, and this is the superior mesenteric artery and the superior mesenteric vein, and this is a large area of the pancreatic head, and again this is the common bile duct here, expecting to see the common bile duct near to the lumen. Yes, this is the common bile duct here near the echo endoscope, near the duodenal wall, and here this is the superior mesenteric artery and the superior mesenteric vein, and here again this is the aorta, inferior vena cava and the aorta, and here this is the common bile duct, and expecting here to see the pancreatic duct. So the IVC and the aorta and the superior mesenteric artery, and here the common bile duct. Yes, this is the common bile duct, and this is a large area of the pancreatic head, and here the pancreatic duct. So common bile duct, pancreatic duct, IVC, aorta, and large area of the pancreatic head with the common bile duct and the pancreatic duct. These structures can be seen during scanning from the upper half of the second part of the duodenum. By gradual withdrawal of the echo endoscope, we are now in the bulb of the duodenum, the station 3, and the whole and most important landmark of this station is the venous confluence of the portal vein, splenic vein, and superior mesenteric vein. And here the common bile duct is parallel to the portal vein, in between the echo endoscope and the portal vein, and here a large area of the head of the pancreas. We are now scanning from the bulb and postbulbar region, and here we can see the superior mesenteric artery, and here part of the common bile duct, and here part of the pancreatic duct, and here a large part of the pancreatic head. Now in the bulb we can do clockwise and anti-clockwise rotation. When I see the superior mesenteric artery, I can do a little bit clockwise rotation, and then I can see the venous confluence of the portal vein, superior mesenteric vein, and splenic vein. Here's the examination, as I mentioned before, is clockwise and anti-clockwise. When I do clockwise, after seeing the portal venous confluence, I can do more and more clockwise to see the aorta and inferior vena cava. Then I start to see the superior mesenteric artery, and then by some clockwise I can see the venous confluence, and in front of the venous confluence is the common bile duct, and then more and more clockwise I can see the aorta and inferior vena cava. So this is the superior mesenteric artery and the common bile duct, and here this is the pancreatic duct. And some clockwise rotation I can see clearly the venous confluence. This is the portal vein, superior mesenteric vein, and here the splenic vein. So this is the union of the splenic, superior mesenteric to form the portal, and here the common bile duct is parallel to the portal vein, and here this is the pancreatic duct. And this is a large area of the pancreatic head. More and more slight gradual clockwise rotation. After seeing the venous confluence, I can see the aorta and the inferior vena cava. So more and more clockwise rotation, I can see the large vessels, aorta and inferior vena cava, and then slight anti-clockwise, I can see the common bile duct, pancreatic duct, venous confluence, and the superior mesenteric artery. This is seen in the bulb with a slight push to see the bulb and postbulbar region in station 3. Now coming to examination from station 4, which is the most important station in linear EUS examination. And actually this station includes the stomach, starting from the cardia and then pushing below the cardia, and the gastric body and antrum with clockwise and anti-clockwise rotation. We can see most of the structures from this station, from the stomach, even the pancreas, even the pancreatic head, and the distal common bile duct, or the whole length of the common bile duct, and the pancreatic duct, and even in some thin patients we can see the papilla. All these structures can be seen clearly from the stomach. So we start at the cardia, where we can see the first structure and the most important structure, which is the abdominal aorta, appearing as longitudinal structure at the cardia. And here, this soft tissue hypoechoic area is the left crus of the diaphragm. And here, the echo endoscope, we can see many structures, starting from the aorta and its main branches. The first one is the celiac axis. We can see clearly the celiac axis, where celiac plexus neurolysis and block can be done. And we can see also the branches and the seagull of the celiac axis, which is the left gastric and the splenic going to the left, and the common hepatic. And we can also see the two main branches of the common hepatic artery, which is the hepatic artery proper going to the porta hepatis with the portal vein and the proximal CBD, and the gastroduodenal artery going to the head of the pancreas. And we can see also the superior mesenteric artery, yes, and the part of the pancreas between the superior mesenteric artery and the aorta, which is the uncinate process. And we can see part of the pancreas at the level of the celiac axis and splenic artery and splenic vein. So we can see here the body of the pancreas, and we can see the uncinate process at the level of the aorta. Then we can do anticlockwise rotation to see the venous confluence of the portal vein, superior mesenteric vein, and the splenic vein, and the neck of the pancreas. And by then we can see the common bile duct and the pancreatic duct. When we do clockwise rotation, we can see the left side of the abdomen, we can see the spleen, and we can see the kidney, and we can see the left suprarenal gland, and here we can see the tail of the pancreas. So even the whole pancreas can be seen from the stomach, including the tail at the spleen and the kidney by clockwise rotation, and the body of the pancreas at the level of the celiac axis and the aorta, and the neck of the pancreas as the venous confluence, and the head of the pancreas by anti-clockwise rotation to see the venous confluence and the common bile duct and the pancreatic duct surrounded by the head of the pancreas. So from the stomach, starting at the cardia and pushing the echo endoscope down, as we will see in the following videos, we can visualize many structures, including even the pancreatic head and the papilla and the hepatobiliary system. Now we will start examination from station 4. We locate the echo endoscope just at the cardia, and we will start searching for our main landmark in this station, which is the abdominal aorta, which is a longitudinal structure here, very clear. And this soft tissue structure anterior to the aorta is the left crus of the diaphragm, and the first big branch of the aorta is the celiac axis. So this is the aorta, this is the left crus of the diaphragm, and this is the celiac axis. And here we will do fine clockwise and anti-clockwise to follow the branches of the celiac axis. This is the left gastric artery going to the right, and this is the splenic, and slight anti-clockwise rotation. Anti-clockwise rotation, we can see clearly the common hepatic artery. And here the common hepatic artery is giving its two main branches, which is the hepatic artery proper going to the porta hepatis and the liver, and the gastroduodenal artery going to the head of the pancreas. And here we can see the splenic vein going to unite with the superior mesenteric vein to form the portal vein. So this is the venous confluence, the splenic vein, superior mesenteric vein, and the portal vein going to the porta hepatis with the hepatic artery proper. This area is the neck of the pancreas. So this is the splenic vein, superior mesenteric vein, and the portal vein, and this is the neck of the pancreas, and this part is the head of the pancreas. Here we can see again and again, this is the abdominal aorta, and this is the first branch, which is the celiac axis, and this is the splenic artery and the splenic vein, and anti-clockwise rotation, we can see the common hepatic artery. And the common hepatic artery, as I said before, gives rise to its main branches, which is the gastroduodenal artery going to the head of the pancreas, and the hepatic artery proper going to the porta hepatis. So this is the common hepatic, and this is the hepatic artery proper, and this is the pancreatico-duodenal artery, and this is the venous confluence. And again, back to the aorta, celiac axis, and the superior mesenteric artery. And then after visualizing the main abdominal aorta and its first big branch, which is the celiac axis, and its bifurcation into its three main branches, left gastric, splenic, and common hepatic, and the common hepatic gives its two main branches, gastroduodenal artery and the hepatic artery proper. We come back to the midline to visualize the aorta again, and then we start to do very important maneuvers, which is anticlockwise, to visualize the head of the pancreas, CBD, and the pancreatic duct, and then clockwise to visualize the left kidney, spleen, and suprarenal. Now we will start to do first anti-clockwise maneuver. This is the abdominal aorta, and this is the celiac axis, the superior mesenteric artery, splenic artery, and splenic vein. And then anti-clockwise, we can follow the splenic vein into its confluence with the superior mesenteric vein and the portal vein going to the liver. So this is the splenic vein, and this is the confluence, and here we can see large area of the head of the pancreas, and we can see the common bile duct clearly from its distal part at the lumen of the second part of the duodenum, and this is the papillary region. All these structures are seen from the stomach. So this is the lumen of the second part of the duodenum, and this is the distal CBD, and going up to the porta hepatis. And this is the IVC and aorta, and this is the venous confluence, and this is a large area of the head of the pancreas. We can see here clearly the pancreatic duct. So here the pancreatic duct, and this is the common bile duct. Yes, this is the common bile duct, and this is the pancreatic duct, no color flow signal inside, and this is the venous confluence, and this is the superior mesenteric vein, and here we can trace the common bile duct up to the porta hepatis. Then I will repeat again, because this is a very important video. Now we are in the middle line, and this is the abdominal aorta, and this is the celiac axis, the superior mesenteric artery, splenic artery, and splenic vein. When we trace the splenic vein, we go to the confluence. This is the portal vein going to the porta hepatis. Okay, and this is the splenic vein, and this is the superior mesenteric vein. So this is the venous confluence, and this is the neck of the pancreas, and this is the head of the pancreas. Here, by fine manipulations, clockwise and anti-clockwise, and push and pull maneuver, we can see clearly the common bile duct here going from the porta hepatis down to the region of the papilla, and this is the lumen of the second part of the duodenum, seen from the stomach, starting from the midline of the abdominal aorta, and then anti-clockwise rotation. Then we can continue, and this is the common bile duct, very nicely seen, the whole length of the common bile duct from its most distal part at the papillary region and up to the porta hepatis. And here you can clearly see the pancreatic duct. Yes, This is the pancreatic duct, meeting the common bile duct as the papillary region, and this excludes pancreatic division. This is the normal anatomy. Pancreatic duct meeting the common bile duct at the papilla. And we here applying Doppler to be sure that these are not vascular structures. So this is the pancreatic duct, common bile duct are meeting at the papillary region. Here you notice that the nearest structure to the lumen of the stomach and the echo endoscope is the superior mesenteric vein, while the farthest structure is the common bile duct and the pancreatic duct in between. This is opposite to examination from the duodenal bulb. From the duodenal bulb, the nearest structure is the common bile duct, and the farthest structure is the superior mesenteric vein and the pancreatic duct in between. So here, examination of the stomach is opposite to that examination of the duodenal bulb. Here, the nearest structure is the superior mesenteric vein, and the most far one is the common bile duct and the pancreatic duct in between. So this is the pancreatic duct, and this is the common bile duct, and this is the superior mesenteric vein. So here, examination of the stomach is opposite to that examination of the duodenal bulb. Here, the nearest structure is the superior mesenteric vein, and the most far one is the common bile duct and the pancreatic duct in between. So this is the pancreatic duct, and this is the common bile duct, and this is the superior mesenteric vein. Okay. This is an example of a somewhat large papillary mass seen from the stomach by examination through station 4 and anticlockwise. This is a large papillary mass, and this is the lumen of the second part of the duodenum seen from the stomach, and this is the distal end of the common bile duct with a plastic stent inside, and this is the venous confluence, and this is a large part of the head of the pancreas. So this is a large papillary mass, and here this is the common bile duct, the farthest structure from the lumen, and this is the pancreatic duct here, and this is the common bile duct with air and a stent inside, and this is the venous confluence, and this is the superior mesenteric vein, and this is the portal vein, and this is the confluence, so this is the neck, and this is the head, and this is the head of the pancreas, and this is the venous confluence and the superior mesenteric vein, and this is the aorta and IVC, and this is a large area of the pancreatic head, and this is the distal common bile duct with a stent inside and air inside, and going down to find a large papillary mass, and this is the lumen of the second part of the duodenum. And this patient was operated and proved that this large papillary mass was a GIST tumor, one of the rare cases of papillary gastrointestinal stromal cell tumor. Yes, here this is a large papillary mass, and the distal CBD and the portal vein and the superior mesenteric vein and large part of the head of the pancreas above and below the superior mesenteric vein, and the neck of the pancreas at the confluence. And here this is the common bile duct going to the papilla, and this is the pancreatic duct here. Yes, and this is the common bile duct, and this is the papillary mass, and here the common bile duct with a stent inside going up to the porta hepatis. So from the stomach we can see all these structures. This is the same mass but seen from the duodenum, from station 2 at the level of the papilla. This is the large mass, Now the echo endoscope is inside the mid-second part of the duodenum, kissing the papilla, and this is a very large mass, about 2 centimeters. It is a large papillary mass, not used to have this large masses in the papilla. It is about 2 centimeters, and here this is a common bile duct with a stent inside, and this is the lumen of the second part of the duodenum, and this is the abdominal aorta. And here we notice that the mass is respecting the muscularis propria layer. It is respecting the muscularis propria layer of the duodenum, and this is part of the head of the pancreas. It is not invading the pancreas, and it was proved, was previously mentioned, that it is a large gist at the papilla, and this is the stent, the plastic stent inside, and this is part of the head of the pancreas, and this is the muscularis propria here, very nicely seen. So the muscularis propria is well respected. So the patient underwent a localized resection. This is a large papillary mass, and this is the well respected muscularis propria layer. Yes, this is well respected muscularis propria layer, and this is part of the pancreatic head, and this is the aorta and IVC. So the large pancreatic, large papillary mass is respecting the muscularis propria and the pancreatic head. Okay. Now back to the neutral position, just below the cardia, and coming back to our main landmark, which is the abdominal aorta. And after visualizing the celiac axis with its branches and common hepatic artery and its branches, and doing anticlockwise rotation to see the pancreatic head and the common bile duct and the pancreatic duct, we are now coming back to the neutral position, where this is the celiac axis, and we push the echo endoscope a little bit, few centimeters downwards, to visualize the superior mesenteric artery. It is very important to visualize these large arteries, to search for superior mesenteric lymph nodes as well as celiac lymph nodes. And here the superior mesenteric artery, and here is the abdominal aorta, and the part of the pancreatic tissue in between the superior mesenteric vessels, artery and vein, and the abdominal aorta is the uncinate process of the pancreas. We can see the uncinate process, as I mentioned before, from station 1 just below the papilla and upward deflection. We can see it beside the longitudinal aorta, and we can see it also from the stomach in this position in between the superior mesenteric vessels, artery and vein, and the aorta. This is the superior mesenteric artery, and this is the aorta, and this part of the pancreatic tissue in between is the uncinate process. So we can see the uncinate process from the duodenum as well as from the stomach. This is an example of mid-CBD stone seen from the stomach, and here this is the venous confluence, and this is the portal vein, and this is the superior mesenteric vein. And here we notice that the common bile duct here is significantly dilated. It is at least 13 or 14 millimeter, and this is the superior mesenteric vein, and it is part of the head of the pancreas, and this is the head of the pancreas, and this is the superior mesenteric vein. And here we can see the common bile duct. This is the mid common bile duct. We notice here that there is a large stone inside the mid CBD. Yes, it is measuring about 14 millimeter. So it is a rather large stone seen from the stomach at the mid CBD. And this is the common hepatic artery, and this is the portal vein, and this is the mid CBD, and this is a stone, shadowing stone inside the mid CBD as seen from the stomach. And this is another example of a large CBD stone in the distal third as seen from the stomach. Here this is the markedly dilated common bile duct, and this is a large stone impacted in the distal third of the common bile duct, and this is the surrounding pancreatic head, and this is the lumen of the duodenum, of the second part of the duodenum as seen from the stomach. And here appearing a large stone, shadowing stone. This misinterpreted by MRCP as a soft tissue shadow because it is impacted. It is not floating in the lumen. So sometimes non-floating stones or impacted stones misinterpreted by the MRCP as a soft tissue shadow. But here, by endoscopic ultrasound, it is very clear, and here the common bile duct is markedly dilated, and this is the region of the porta hepatis with the portal vein and the hepatic artery proper. Now we come back to our neutral position and our landmark, which is abdominal aorta, and this is the first big branch of the celiac axis, and this is the splenic artery and the splenic vein, and this is a part of the body of the pancreas surrounding the splenic artery and the splenic vein. We are now doing clockwise rotation, or rotation to the right, clockwise, and this is part of the body of the pancreas, and here appears the left kidney. So now we came to the tail region. The tail region appearing at the level of the left kidney, and this is a small angiomyolipoma of the left kidney. Yes, this is small angiomyolipoma, and this is a part of the pancreatic tail, and here we can see the left suprarenal gland, the seagull appearance of the left suprarenal gland, and more clockwise rotation we can see the spleen. So this is the left kidney, and this is the spleen, and this is the tip of the tail of the pancreas. And now coming back to the left kidney and the left suprarenal gland. Yes, here this is the left suprarenal gland, and now back to the abdominal aorta. So by doing clockwise rotation we can see the left kidney and the pancreatic tail and left suprarenal gland at the upper pool of the left kidney, and more clockwise rotation we can see the spleen. Now we came to the end of the lecture, and the take home messages is there are لا ثانية واحدة نكمل مش مشكلة. Now the take home messages are there are 4 main stations in addition to the liver and the mediastinum through the esophagus, and finally the root of the neck. You can start from below upwards, station 1 to 4, or the opposite, and the best way of EUS examination is the way you are used to do and perfect, but try to identify the landmark of each station. And thanks for your attention.